Alright, today we're going to go over fluid and electrolytes. For Jero, we're going to check this one out, have fun with it, and see what we can get to. Got some objectives. Hopefully we can answer these and try our best. Alright, so water has a couple of functions. What do you think they are? So it's responsible for thermal regulation, and that is the ability of an organism to keep its body temperature within certain boundaries, even when the surrounding temperature is very different. It's also has a function of dilution of water-soluble medications. It is responsible for the facilitation of renal and bowel function, and it's needed for the creation of needed conditions for metabolic processes, stuff like that. All right, so what do you think dehydration is? So it's a depletion in total body water. It's pathological fluid loss, diminished water intake, or hypernatremia. An extracellular fluid compartment draws H2O from extracellular fluid. It's a geriatric syndrome. It exacerbates an underlying condition. So it can exacerbate UTIs, respiratory depression, and things like that. It's kind of neat. So what are some age-related changes that affect fluid status? So we have diminished thirst sensation, but we know thirst is not proportional to metabolic needs in response to dehydration. We have a decrease in creatinine clearance and glomerular filtration rate. This decreases the ability to concentrate urine. Total body water decreases, so we have less fluid reserve. We also lose muscle mass and increase fat cells. So we know fat contains less water than muscle, so we're just going to have less water. So what other things do you think would affect fluid status in other adults? Medications would do it, like diuretics, functional impairments, and then medical and emotional illnesses. So what are some age-related changes that happen to the kidneys? What you think? So the glomeruli decrease due to glomerulosclerosis. The size and number of nephrons decreases with age. Renal blood flow declines 10% per decade. GFR declines due to change in glomeruli and clustering of capillaries and renal blood flow rate. Okay, so what else can compromise blood flow to kidney and GFR? Well, we know medications, these processes, but elimination of waste and toxins, if that declines. So why is the decline in GFR significant with age? So it's like these things, you read this, I'm not sure. Okay, so what are some factors that influence hydration management? So the presence of a physical or emotional illness, if they had surgery or trauma, if they have a condition of higher physiological demands, and certain meds. So what are the risk factors for dehydration? If you have age greater than 85, you're female, you have a dependence in feeding, you have dementia, you have 4 or more chronic conditions, polypharmacy, fever, infection, you have a history of dehydration, you take diuretics, you're depressed or you're lonely, and you have inadequate supervision. All right, so how do you think we're going to assess hydration relationship to hydration status? So we're going to use this dehydration screening tool. So what does the dehydration stand for? All right, so it stands for drugs, end of life, high fever, yellow urine, turns dark, dizziness, reduced oral intake, axilla dry, tachycardia, fear of incontinence, oral problems, neuro impairment, and sunken eyes. So things like that. Signs and symptoms would be like dry mucous membranes, orthostasis, tachycardia, oliguria, weakness, sunken eyes, speech incoherence. So when do you think we might start seeing the clinical manifestations of dehydration in older adults? That's when dehydration is usually severe. So assessment of hydration status, what are we going to do? What are we going to assess? We're going to assess oral mucous membranes, the sublingual saliva pool, weight changes, if they got any confusion, any muscle weakness, do their eye and nose, the urine characteristics, BUN, serum osmolarity, sodium, BMI less than 27 or greater than 27, stuff like that. All right, so what are some interventions for prevention and management of dehydration, stuff like that? So we're going to teach them how to use a urine color chart. So if it's clear, what does that indicate? Very good. What about if it's light yellow? It's good. What about yellow? It's fair. Dark yellow, light dehydrated. What about amber? Dehydrated. What about brown? Very dehydrated. And red, severe dehydrated. You can also do IV resuscitation. And we can do hypodermocolysis. It's the infusion of isotonic fluids in the sub-Q space. However, it cannot be used in severe hydration if more than 3 liters in 24 hours is required. But what's the first treatment approach to dehydration? Oral hydration, okay? So, what is the risk identification for like dehydration, stuff like that? Vomiting, diarrhea, and fever. So, what's some acute hydration management things that we can do? Monitor INOs, give additional fluids, minimize fasting time for procedures. So, for ongoing hydration management, the long term, what's the daily fluid goal? 100 mils per kilogram for first 10 kg, then 50 mils per kilogram for next 10 kg, and then 15 mils for remaining kg. And 70% of this is for fluid volume intake. So what percentage of fluid should be during meals? 75 to 80. And what percent should be not during non-meal times? 20 to 25. All right, tell me about fluid rounds. So, supervising them to swallow, toileting, and giving them fluids. You can have a happy hour tea time to drink, a variety of fluids throughout the day. So what type of bladder irritants should we avoid? Carbonated drinks, citrus juice, alcohol, and aspartame. And if caffeinated, should be 2 or less a day.